So I'm going to bring Dr. Hinkle back up to talk about some PD research and upcoming clinical trials. Thank you.
Thanks. All right, I trained for the move back and forth, and I would never yell at you. All right, but you're right. There are, and we haven't really done a good service with this particular session of kind of talking about the non-motor, non-movement types symptoms, kind of the broad symptoms, but more kind of to people wanted to know a little bit more about the science, what's happening, and what are people doing to try to get this under better control. So that is what the last talk is going to be about, and I'm going to talk about some of the clinical trials and research that is happening now and in the near future to try to come up with ways to slow the course of progression. So this is a busy slide, but basically I've seen before there are 400 or 500 clinical trials going on right now that about half of them are for disease modification at the top, slowing progression of the disease, and then at the bottom, probably more looking at symptomatic therapy for movement and non-movement features of Parkinson's. There's basic science that's done in animal models and in the dish, and treatments that look promising will then go into clinical trials in people. So when you see phase 1, that's more of a safety and tolerability. They'll try it, make sure it doesn't cause too many problems, but they're really looking to see, is this something that someone will tolerate? Then they'll go into phase 2 trials, a little bit bigger, looking a little bit more for clinical improvements. And then phase 3 are the kind of the big trials that are done with hundreds and hundreds of people looking for clinical benefit. And if those trials come up positive, then they will be looked at by the FDA to be made into an approved medication for whatever purpose. So that's kind of how the research process goes. With that in mind, why don't we have a cure yet? You guys have been working on it for decades now. Why don't you have anything for me yet? Part of the reason is that the dopamine area involved that helps with mobility, or that causes the problems with tightness, slowness, tremor, is pretty small. It's in the area called the substantia nigra, which is deep in the brain, and it's deep under. This is a section like this of the brain. The brain's under skull. That's a tough area to get to study, and then even more so, the area of the brain that's involved with Parkinson's disease is about the size of a piece of cooked rice, and we just, in early stages, any stages, we can't go in and take samples of those cells like dermatologists can from the skin. We can't get the biochemistry. Our MRIs don't look that deep. So we just don't know in the early stages in a human patient what's happening there. We just don't have the resolution of techniques to get there, and that's in part the problem. Another part of the problem is that the progression of the disorder on the right side is what a person's brain may look like before they die, and that might be 30 years into the progression of the disorder. So we can take a brain out when someone's done using it, cut it up and look at it under a microscope, and what we see there is 30 years in. It doesn't really inform us too well about what's happening on the left side of the screen early on. What's starting the process? What are the key mechanisms that are happening early on that if we could catch them and stop them, then that whole progression doesn't occur. We just don't have the techniques to do that. Another part of it, it's pretty darn complex. There are a lot of mechanisms involved, involving different components of the brain structures and different biochemical processes, and they all tend to kind of work together and worsen each other to ultimately produce cell death. So I'm just going to talk about a few of these individually and some of the techniques that are being used to try to address. So mitochondria are little energy packets within our cells that help the cells to survive. They also do a lot of work with kind of balancing off calcium, magnesium, things like that. They're very, very important for most cellular function. And in Parkinson's disease, they start having problems and they don't function as well as they should, and they can also produce some toxins that promote the disorder. So just looking at the kind of the whole group of clinical trials, kind of the upper part there, surrounded by the yellow lines, there are a few compounds that are in phase 2 trials, so bigger studies looking for clinical benefit in terms of disease modification, and specific agents, nicotinamide riboside can support the mitochondria. A lot of these agents are also found in foods, so we don't have pills yet that I would suggest using, but if this type of agent is helpful, maybe the veggies, fruit approach might be helpful. There's a lot of work showing that insulin resistance, diabetes mellitus is associated with higher risk of Alzheimer's in particular, probably Parkinson's. Alzheimer's, some are calling diabetes type 3 these days. So some work is being done with insulin, which can come under better control with exercise, weight loss, and a healthy diet. Glutathione gets a lot of press. There are nasal therapies that people have tried that just haven't worked out. I wouldn't recommend using them, but again, another way to try to optimize this mitochondrial function. And the research on the mitochondria goes back decades. It's clearly a central point to the process. We talked a little bit about oxidative stress before, where oxygen that we breathe gets activated into a way that it just kind of attacks proteins and other molecules, changes their structure, makes them not function or makes them function in a toxic way. Antioxidants have been studied for decades. Vitamin E, vitamin C just really haven't panned out in terms of taking supplements at least. But there are a few agents that are being looked at, a little bit more robust antioxidants in phase 2 trials now. Sulforaphane is a pretty powerful antioxidant that's found in broccoli and cauliflower. So the agent itself is being studied, but maybe getting more of those cruciferous vegetables in your diet might help. Tocopherol is a kind of a more potent form of vitamin E. I've never heard of rice or palm oil, but it's out there, and it's being studied to see if that's going to be something that might be a little more potent on this mechanism. And then again, glutathione is a long-studied, very potent antioxidant, and so there's still work being done on battling down oxidative stress. Neuroinflammation that also involves support cells of the brain is a very, very hot topic of research right now that can cause cellular damage and death. There are now several agents in phase 1 and phase 2 trials looking at this. Sargramostin is already being used to kind of build up white blood cells to battle back bacteria and viruses in people who are on chemotherapy. There's some evidence that it might improve anti-inflammatory white blood cell populations, so that might be helpful in Parkinson's disease. And then pentoxifylline is already being used to kind of grease the blood vessels to reduce stroke risk in particular persons with high risk, but it has a very, very strong action against the production of pro-inflammatory molecules. So that is being looked at again for the inflammatory arm of Parkinson's disease. And then we've talked about kind of the trash buildup before of the alpha-synuclein process, where normal alpha-synuclein under conditions of oxidative stress, neuroinflammation, is made into these misfolded forms that aggregate and kind of choke up the cell. And there is evidence from back to 2 decades ago that these intermediates, these aggregated intermediates, actually are very, very toxic to cells through a variety of mechanisms. So there are phase 1, phase 2, and actually one phase 3 study being put together to look at multiple approaches against this aggregation process. And actually, each stage of the mechanism is being looked at to use molecules to try to stop the misfolding, try to stop the stickiness and aggregation, try to stop the seeding and the buildup. So there are molecules at each stage of the process that are being studied at different levels to try to stop this process, to stop Parkinson's in its tracks. There are also small molecules that are being looked at to try to beef up the acid digestion lysosome, the paper shredder proteasome, which survey the cells for these abnormally folded, dysfunctional or toxic proteins to get them out of there so that only the normal functioning proteins will be present. So there's a lot of work in that regard. There's a lot of work over the last 10, 15 years in environment and genes. Environment, there's a lot of epidemiological evidence that chronic exposure to pesticides, herbicides increases the risk for developing Parkinson's disease. There's newer literature about air pollution and even newer literature about flu and COVID, so viral infections, increasing inflammation, increasing the risk for Parkinson's disease. So can't live in a bubble, but the vaccines are important for that, and I know that a lot of neurological agencies are talking with government about trying to find ways to reduce the pesticide herbicide use in society, and I think these environmental exposures are probably part of the reason, plus better longevity of life, why a higher percentage of people will get Parkinson's or Alzheimer's now than did 100 years ago when we didn't have all this stuff out there. So that's a very, very hot topic of research right now. Genes are probably the biggest topic of research right now, in part because we can't go in and take pieces of the brain, but these genes listed here, when mutated, will cause Parkinson's disease. So now, what's the biochemistry, what's the physiology of these mutations? Are there mechanisms that crosstalk, that come together? Are there common pathways that are messed up, so to speak, by mutations here that we can use to understand the mechanism of the early brain disorder? Alpha-synuclein we've talked about before, glucocerebrosidase and LRRK2 are being looked at very intensively, and you can see that there are phase 1, phase 2, and phase 3 trials currently ongoing for these genetic Parkinson's disease forms, hoping that they will apply back to kind of the sporadic Parkinson's disease. So there's a lot of work being done in this regard. Another hot topic right now is the glucagon-like peptide-1 agonist, or GLP-1. Lots of commercials for Ozempic and Wegovy on TV now for weight loss, anti-diabetes. These agents are being studied very extensively in neurodegenerative disease, Parkinson's and Alzheimer's. Again, Alzheimer's being called by some diabetes mellitus type 3. So in addition to the weight loss and anti-obesity approaches, there are a number of clinical trials going on now in phase 2 and phase 3. The phase 3 was actually just published. And the source of the interest is that these agents increased insulin release, so lower diabetic risk, reduce people's appetite, so people don't want to eat so much, they don't gain as much weight. That again lowers diabetes and Parkinson's risk. In animal models, these agents reduce the alpha-synuclein tackiness and binding together, so maybe that pathway. And there are varying levels of anti-inflammatory mechanisms of these agents in animal models. And when you look at the amount of dopamine cell death in these animal models, it goes down with these agents. So the science behind it is exciting, and now clinical trials are ongoing. So I know that's a kind of a quick tour through what's happening. But the main point is those are key mechanisms, and scientists are working really, really hard to try to figure out how to diagnose early and slow down the progression. My recommendation to my patients is I want the science done. There's a lot on the internet. You should take this, you should do that, you should eat this. There's tons of information, and nobody on the planet knows all the answers. I absolutely don't know all the answers. There's a lot of good work, but I wouldn't start taking high levels of vitamin E, high levels of vitamin C. You know, people tell me about using ginkgo biloba in the past, and that was kind of sold for memory function and wellness, but ginkgo biloba also increases bleeding risk, and so people would have operations and bleed out in the operating room. So I tell people that sharks are natural just like other things, and we just have to be careful, and I don't like jumping the gun before we know something is going to be helpful and worth using and is safe. Scientists are working hard. Please support them. Please let your elected officials know that it's important, because I don't know who else is going to do the work to help us all for the future. Okay, so sorry, kind of quick, but that's what we're doing today to try to get kind of key information out, and I've got 1.5 minutes to run to the other room. So thanks very much for your time today, and people are certainly welcome. I'm going to give this same talk at the end of the other session, but people are certainly welcome to kind of filter into the other session if you'd like. Okay, so good luck with everything. You can do very well with this. You can live nice, long lives, productive lives, fun lives. You've got a lot of control over this. It's absolutely an anchor, but you can make the anchor smaller. Friends, family, exercise, diet, talking with your docs. Some things are very Parkinson's related, some things aren't. We have a decent understanding of that, and we can do a lot to help you. I wish we could cure it, but hang in there. This is where this is. I was wondering where this was. There's my memory. Okay. All right. I'm going to run down the other end. Thank you so much for your time this morning. I hope it was helpful for you.